We'll go ahead and get started. All right. Good afternoon, everyone. Thank you to those who are here in person and those joining us on Zoom. I understand there's quite a robust audience on Zoom today from institutions close to Chicago, but also a little bit further away. Because our speaker today, Mr. Arnold Davis, is well known to people here, but also people who are passionate about nephrology elsewhere. Mr. Davis believes that the time is now to create nephrology that is most innovative, all-inspiring to among all the medical subspecialties. And if you are on social media, you might have seen his activity in this space and constantly pushing all of us to do better for our patients. He himself is a patient with polycystic kidney disease and has been a very strong advocate, as you'll hear, in this space. He's had involvement in many spheres, including social media, but also in the American Society of Nephrology, the O'Brien Kidney Center, and many other nephrology activities. And one of the things he's most proud of is that he finished in the top 1.5% in the Neph Madness competition. So I think we have an expert to go to the next time we fill out our Neph Madness bracket. Maybe we can invite you to do this with us. And if you don't know, Neph Madness is a competition against over 1,000 nephrologists and kidney scientists predicting hot topics in nephrology. Mr. Davis has his MBA from Northwestern and many leading certifications in finance and accounting, and over 15 years of experience holding local elected positions in the community. He'll speak to us today from the perspective of a patient with kidney disease, a patient advocate, someone in the medical family, and someone who has seen a lot of initiatives in community spaces come to fruition as a result of passion and leaders and innovators. So, Mr. Davis, thank you very much, and we're delighted to have you here today.
Thank you very much for that warm introduction. It's my great pleasure to be here. This is really where it all started. I got diagnosed back in 2017. By 2018, I was researching nephrology left and right, and I was reading about concerns people had about the future of nephrology, and I said, yeah, this just doesn't feel right. If we do this the right way, we end up with the hottest medical subspecialty in all of medicine. And I went to the people I knew at Northwestern, and I literally thought to myself, they're going to look at me like, who is this complaining guy? Like, get out of here. And they just brought me in like one of their own, which I'll get into the details of. So I've always been incredibly appreciative of what everything Northwestern has done for me, with a special shout out to the fellows, the junior faculty, that without each of you, like, I literally would not be standing here. That is the early career people that were the launching pad that then from there enabled me to build relationships with ever more senior folks. In terms of my disclosures, I'm super proud to say that I sit on the Patient Advisory Council for the O'Brien Centers, which, for those of you not familiar, is a national consortium of kidney research centers funded by the NIH. We have one here at Northwestern, as I'm sure you all know. I started out on the committee here at Northwestern and then ended up on the national one. And then about 2 years ago, the ASN sponsored me to attend Kidney Week, which was a huge educational opportunity for me. And other than that, I have no other interests, although I like to think of myself as the most conflicted person you could possibly meet in nephrology, because the more nephrology advances, the better shape I am in as a patient. So, and then you can see whatever you want to see that I've ever said about nephrology, I have posted out on social media. So what would I like to do here today? First of all, like I alluded to a minute ago, I really want to thank everyone at nephrology at Northwestern for what they've done for me, both on the clinical side and on the research side. We'll get into some more details on that in a few minutes. And then I want to expound on where I think nephrology is going and how all of us can play a leading role in making that happen, no matter what your role is in nephrology. And I will take you through a lot of my history, not so much to talk about myself, but to illustrate that people along the way who've had an incredible influence on enabling me to do what I've done, from random encounters with medical students, deep work with fellows, so on and so forth. Yeah, and it all began with my father, who spent his career at Lurie Children's. That's him on the screen. And he was a doctor through and through. And uh, he has always been my role model for this, he would sit at the dinner table and he would worry about the future of pediatrics. Well, living here in Chicago, I keep seeing Lurie Children's expand and expand. So I can see that concern does not mean destiny. So when I hear people concerned about nephrology, yeah, I just think to myself, okay, that is one more challenge for us to overcome and take us to the next level. And he was a huge fan of his mentees, that year after year, I would start hearing about his residents while I was sitting around the dinner table and he and my mother were talking. And then I would see them as their careers progressed and they took on extremely innovative roles, always reflecting who they were and their most authentic selves and making incredible contributions to medicine, be it genetics, HIV/AIDS, medical education. I'm super happy that one of his mentees, Dr. Sandy Sangino, is here with us today in the audience. Thank you for being here. And so I also want to thank really everyone from Lurie Children's, that it's the culture of Lurie Children's that I saw in what I just described, that I always take with me to say, yeah, that culture is what we want to have as the culture of nephrology. Yeah, so, yeah, if I were to skip way ahead and say, okay, yeah, based on what I saw with my dad, his mentees, how things played out, current trends in nephrology, yeah, I could not be more optimistic. And that, yeah, here we have very strong division leadership. And my dad was spent his entire career as a division head. So I've seen how it plays out when you have a great division head who's also mentor of the year. Yeah, Dr. Izakova, I emailed her when she became the interim head. I emailed her again when she became the permanent head. She accused me of congratulating her twice. I said, absolutely not. Those are two separate things. I'd be remiss if I didn't congratulate you both times. Yeah, and then I know so many people in the division and so impressed with all of them. And then we combined the overall trends that I could not be happier for each of you to be in this division at this time with these opportunities. A little jealous, I have to be honest, but yeah, life is what life is. And I'm very happy to be in the role that I have. Yeah. On a more somber note, my introduction to nephrology began about 20 years ago. My dad had ADPKD, and in his early 60s, things took a turn for the worse. He ended up on dialysis. The dialysis clinic was 2 blocks from my office. So 3 days a week after work, I would pop over there to help him and my mother get home. So I saw dialysis upfront and personal. Yeah, the look on my dad's face the very first time I showed up in dialysis clinic just said everything. Yeah, then he was on that for about 6 months. Then he went into transplant. I was there for transplant evaluation. I was in the pre-op room as they wheeled him and my wonderful aunt, who was his donor, in for surgery. I was there as they came out and they said it was making urine in the operating room. I never thought I'd be so happy to hear about urine in my whole life, but that was my introduction. I was hoping that I'd be okay, that it didn't affect me. I'd had high blood pressure since my mid-20s, probably earlier than that. And I always felt that just being over 6 feet tall, over 200 pounds, that was doing it for me. But around the time that his kidney journey was coming to an end, the doctor, my primary care physician, said, "Yeah, your kidney function's declined. You need to go see a nephrologist," which took me into the next phase. Yeah, I should rewind a little bit. That Dr. Friedwald, thank you, was my dad's transplant nephrologist. My dad had every internal medicine thing going against him that you could count. I mean, more stuff that you could shake a stick at. And some of his other issues did not agree with the transplant drugs. He went 10 years without a rejection episode. I just rock star treatment from Dr. Friedwald, from the entire team, from in the department, the nurses, administration, yeah, everybody. Yeah, I could not be more grateful. The first time right after transplant, my dad told me about Dr. Friedwald. He had this look on his face of, "Oh, I discovered another one, another uber talent in medicine," which he spent his career doing. And those next 10 years proved that he was more than right. Then I got referred to Dr. Gosain. I was the completely over the top patient. I was the patient you don't want. I stayed in clinic way too long with way too many questions that in hindsight, now I know more, they weren't going anywhere. Yeah. And she had a fellow who's now at Duke, Dr. Frazier, uh, who, same thing, except she had the added treatment of getting all my chart messages. And yeah, I was that my charter person that you don't want either. She was a second year fellow, so she was my doctor for a year. I had 40 different my chart conversations, that everything I could think of in terms of blood pressure control, things in the research pipeline, you name it. I reached out to her at any time. She could have said, "Listen, I have patients who are way higher priority. I have too much on my plate. You just got to stop." She never did. In fact, she just kept encouraging me. And the whole thing came to a peak when she was a week out from leaving on maternity leave. And actually her kid was due in a week. And was no longer seeing patients in clinic. And I went to her, I said, "Well, I've got this issue that the one drug that could slow down my polycystic kidney disease is coming on the market in a couple months. And there's this other really promising drug trial, and I've researched them unbelievably extensively. And I spent way too much time. My family's sitting there telling me, like, dude, like, lay off." But I went to Dr. Frazier. I said, "From a medical point of view, no one knows where I'm at better than you. Yeah, is there any way we could talk? Because I'm going to talk to the principal investigator for the research trial." And so she scheduled a time to talk to me on the phone. So I'm thinking she's just gonna, yeah, tell me some generalities. She's got too much else going on. No, she had researched the study. She's given me like super informed questions to go ask, which we spent half an hour on the phone. I totally appreciated it. When I go and talk to the principal investigator, they're looking at me like I'm funny. Like, how's this guy who just walked off the street so informed? So at that point, yeah, I understand all the pressures in medicine, the time constraints. I went to my sister, who's a doctor who went to medical school here, and said, "Okay, this is what Dr. Frazier did for me. How do I thank a doctor?" I felt like I could do a lot more than say, "Gee, thanks." And she said, "Send a letter to her attending that talks as much detail as you possibly can about why you think she's so great." So I did exactly that, telling Dr. Gosain everything I just told you, and sent it off to Dr. Gosain. I am told the letter went straight to her personnel file, which I'm super proud of. And so at that point, I thought, well, she graduated. I'll never see her again. That's the end of her influence. I could not have been more wrong. Five years later, I'm at Kidney Week. I'm on the patient panel in front of 350 medical school students, right up there on the screen. And I went in determined to create a nephrologist or two that day. And there's this doctor, Dr. Stacy Leisman in New York at Mount Sinai, who once talked about how when people express an interest in nephrology, doctors can come on too strong. So I'm like, I'm not making that mistake. So I'm at this social gathering where there's a bunch of medical students the night before, and they told me what my question on the panel is going to be. I'm testing out my lines until one medical resident puts his hand over his heart, says, "That's incredible." So I go in, I'm like, okay, I got this. I deliver it just the way I wanted to. I think I'm done, mission accomplished. Well, some random medical student stands up and says, "What is a time you felt the most human as a patient?" And I'm like, wow, this is gold, that I got this great example from a fellow just a couple years away from where the medical students and residents in this audience are going to be. So I told them all about her. I looked down, and there's two presidents of the ASN, Dr. Cruz and Dr. Josephson, smiling ear to ear. Then afterwards, Dr. Quaggan comes bounding up to me and says, "I know who you're talking about. That was Rebecca Frazier." So anytime I can make three presidents of the ASN smile, like that's a good day. Yeah, then about around Christmas time this year, I got a call from Dr. Matthew Sparks at Duke, who says, "Yeah, I remember that talk at Kidney Week. I want you to fly down to North Carolina. We're having a fellows night with the fellows from Wake Forest, Duke, University of North Carolina, and I'd like you to give a talk." I go, "Okay, what would you like to talk about?" He goes, "Yeah, remember Kidney Week? That's what I want you to do." So I did that, and yeah, that one's really nice because Dr. Frazier was in the audience, so I could see her smiling as I recounted this. I mean, for all I know, 40 MyChart messages and bothering the week before she's going on maternity leave. Yeah, she might be thinking like, yeah, this guy's a total pain. And so, as you could see by what a doctor from North Carolina posted that night, yeah, that was terrific. I was literally the last person to leave as people were coming up to me and talking to me. Yeah, and then, yeah, as if, yeah, to further paint the picture that, yeah, you can have as a second year fellow. Yeah, I figure we're done with this episode. Well, not quite. The Kidney News, the ASN publication, sends me an email and says, "We saw your speech. Could we do a 1,000-word profile of you in Kidney News?" So they did a whole interview with me. They even sent me a copy and said, if you want to make any edits, have at it. So I sent a note to Dr. Frazier. I'm like, yeah, I don't want to be talking about you in front of your entire professional world with something you're not okay with. So I want to make sure you're good. She was, and then that showed up in my mailbox. Made me super happy that if we have 10,000 nephrologists in this country and the publication goes to 15,000 people, including every member of Congress, to get the word out on what we can be doing in nephrology. So the point being, and I'll repeat, that, don't underestimate the influence that you can have, just in this story alone, as a second-year fellow. Had that random medical student, I have no idea what her name was, not asked that question, none of this would have happened. Yeah, so then if I rewind all the way back to 2017, I'm newly diagnosed, I'm researching left and right. I watch on YouTube a replay of John Oliver taking after the dialysis industry. I'm completely shocked. I'm like, what is this? I even though I had spent 6 months in the dialysis clinic, I had no idea what was going on. So with my financial background, I started delving in. I'm researching the financial reports with the Securities and Exchange Commission, learning about $1 billion in fines, all sorts of other issues. I can see how much they're spending on research and development, not much. And so it became clear to me like, oh yeah, John Oliver, it's a comedy show, but he was factually correct. And yeah, I felt like I just couldn't stand by and say nothing. So I email Dr. Gosain and I say, yeah, this is what I'm seeing. These are my concerns, but this is my view of a brighter future. I mean, just take dialysis. We have 50 years of material science advancement. Let's be applying that. Yeah, I'm a little worried. She's just gonna be like, hey, again, I got too much on my plate. Yeah, if this is how you feel, go bother someone else. Not at all. She sends me right away this really nice note back, and she says, by the way, we are starting a research consortium and putting a committee together. Would you be interested in serving on it? I said, absolutely. Yes. Yeah, she forwards my note over to Dr. Quaggan. More, I would have even dreamed of asking for that. Yeah, and yeah, it's been a very similar story going forward. If I reach out to people, they could not be more generous with their time and their resources. Yeah, with that, I was feeling a little emboldened. So that the only other email I had, I was young and naive at that point. I didn't realize I could pull down people's publications and find emails of publication authors at that point. But I only had one other email address, which was Dr. Arlene Chapman at the University of Chicago. So I emailed her with almost the identical email that I sent to Dr. Gosain. And she immediately invites me to join the TREX, be a panelist at the TREX program that very weekend. So for those of you not familiar, TREX is what I call summer camp for medical students and graduate students. That they'll take you to Maine outside the national park, or they'll take you to the University of Chicago for a week of all sorts of fun activities, but basically a sales pitch on nephrology. And so for the one in Chicago, they bring PKD patients to meet with the participants. And so we go into a small group sessions. I tell them about myself, and I say, listen, I'm an open book. Ask me anything you want to. And I absolutely love it because almost invariably there's some tie to nephrology. There's a family member, something like that, that brings them in. And I had heard that the annual survey results were really strong. But at one of these, a medical student writes this blog post that's on the screen talking about the influence that I'd had on him. So now whenever I'm speaking with people in nephrology, I think of this medical student, and I think to myself, okay, you did it once, you could do it again. Just, adjust for the level of experience you're talking to. Yeah, this year I've spoke with everyone from undergraduates to a seminar at the NIH. Yeah, and then about the same time, I found through my daughter, who's a second-year medical student, Ellie, who's in the blue shirt towards the back. Sorry, Ellie. Was on Twitter, and I said, I don't need any more social media. I'm not into the social media thing, but just randomly, I look up nephrology. I very quickly find Dr. Quaggan, Dr. Weitzman, who was a fellow at the time, Dr. Lin, who was junior faculty at the time, and I'm reading so many of their posts, the algorithms were just naturally putting them right to the top. Yeah, I start seeing posts like this from Dr. Quaggan, and I said to myself, okay, clearly there is an audience out here and a group of nephrologists who really strongly believe in the future. And it really came home to me, speaking of Kidney X, is they did like a web chat on Twitter that June. And I'm sitting on my front porch, and I started tweeting out, like, we could do so much more. Like, what about nanotechnology and plus dialysis? And immediately I get like half a dozen likes. I was like, okay, who's liking my tweets? And it is all early to mid-career people, mostly female. And look, I'm not a scientist, right? I'm not going to sit there and say, what's the p-value of this? But yeah, I'm a business guy. I'm like, okay, now I got my hypothesis, my target market of who that is, and and who's going to be receptive to a message of creating a revolution in kidney care. So from there, I start tweeting out left and right. More and more nephrologists and researchers are following me. And I found this online nephrology journal club. And Dr. Weitzman and Dr. Lin were super involved. And about the same time, this super high-end study on the molecular composition of PKD comes out, way above my knowledge. I'm not going to kid anyone. But I went to Dr. Lin and I said, and keep in mind, she's junior faculty at this point. She's probably a couple of years out of fellowship, if I remember correctly. And I said, do you think they'd be willing to do this as a topic? Well, not only does she get it accepted as a topic. She lines me up to write the commentary on it. She gets Dr. Weitzman to take his kids' Legos, which is what you see on the screen, and to create a video explaining how the molecular components come together and they all work. I mean, I was blown away that with everything they had going on, that they took the time to do this. And then they had a Twitter online forum for the Journal Club. They had one in the United States, they had one in Europe. And at that point, I just knew I was on my way, but between the way as I was getting brought in. And a while after that, I went to Dr. Gosain and I said, yeah, I've been reading Dr. Quagan's posts on Twitter. Yeah, I really like what she's saying. Would it be okay if I reached out to her? And she says, it is. I cannot give you her email address. I said, that's okay. We follow each other on Twitter. I can send her a direct message. So I sent her this way too long, and I mean way too long, note saying basically, I'm a big fan of yours. And she says, I did preface it that I am only writing in your role as a board member of the ASN. I didn't want to think I was some disgruntled patient out there. And so she says, this is great. Well, let's sit down and talk. So like 2 weeks later, I'm sitting in her office. I am still all these years horrified because I was so excited that I couldn't sleep well that night. So I slept in a little bit. I was 5 minutes late getting to the meeting. And then that led to right here in this very room was the first O'Brien Kidney Symposium. I asked Ashley Suppose, who was the manager of the O'Brien Center at the time, would it be okay if I popped in for like an hour or two? And she's like, yeah. So I show up, I walk in the front door, I wave hi to Dr. Quagan. Well, about 2 minutes later, she had clearly done a major U-turn to come over and personally greet me with everything else was going on. I was so enamored with the speakers that had flown in from around the country that I invited myself to stay all day long. And at the end of the day, I'm talking with the speakers, about 3 rows in, right about here. And Dr. Quagan is right here organizing some papers. And she says, would you be willing to join the executive committee of the O'Brien Center? Which just blew me away. I mean, I knew this was, something that was so important to her. And I had one small problem with it. I was already on 2 different boards in the community. I told my family, I promise no more extracurriculars. My cup is full. You have my word. So I knew I was going home to say, well, I lied. And fortunately, they were extremely supportive, more supportive than I might have been if I were in their shoes. So thank you very, very much for that. And that turned into an absolutely amazing experience to be able to sit with leading researchers doing cutting edge work, really understand how you think so that I could in turn be a more effective advocate. So with that, I'd always thought to myself, I should go to Kidney Week. And the reason is Dr. Gosain said to me once in clinic, hey, were you at Kidney Week last month? And I said, no. And I'm thinking to myself, does someone like me really belong at Kidney Week? But the way she said it, she half expected that I had been there. So I couldn't get out of my mind. So I applied to the ASN for them to cover my travel expenses. And with that, you get the VIP treatment. And I'm sure that it only helped my application that I had been on the O'Brien Center Executive Committee for 3 years at that point. So thank you all for that very much. You can see the group of patients with the leadership of the ASN after one of our breakout sessions at that Kidney Week. And then, that's led to further relationship building. I got to know people at the NIH. And earlier this year, they came to me and said, would you speak at our kidney imaging webinar? I said, sure. And with everything that's going on, it was uncertain if it would happen or not. Finally, they scheduled it for April 1st. Well, this is what was happening on April 1st. So the webinar starts, the head of that KUH section of the NIH gets on to kick it off and acknowledges that this is one of the worst days ever for the NIH, what a terrible day it is. He quickly left to go deal with the crisis happening at the NIH. And it's like, okay, what am I supposed to say after that? Well, this turned out to be the day that Northwestern had trained me for, that all those meetings on the O'Brien Center, yeah, all the engagement with people in clinician, yeah, I felt like, okay, I can see inside, get inside the head of what people at the NIH must be feeling today. So I had previously shared my prepared remarks with the section head of the NIH, Dr. Neilani, and had his sign off. Well, yeah, things change. So I said, I have to do what I can to motivate the NIH people and the research people who are attending today, which is exactly what I did. So thank you to the education that you all gave me. And I knew I nailed it when the next speaker after me says, wow, that's a tough act to follow. Yeah, then as things continued in this year, and we were looking at potential 40% budget cuts at the NIH, I said, I have to do something. And Dr. Quaggan had suggested that I join the Patient Advisory Council, like I mentioned earlier, of the NIH, National O'Brien Centers. So here I am having a quarterly meeting with other patients. I'm normally not a big fan of advisory committees. I like to do them so I can build relationships with people. But I said, wow, we could turn this around and have some value. That I'd once read a study by the economist Adam Grant, where he found that when a group of fundraisers heard a speaker who was impacted by the fundraising they were doing speak before they started work, that their productivity went up exponentially. Interestingly, the fundraiser said, oh, that speaker had no impact whatsoever, but they kept repeating the experiment successfully. So I said, well, let's flip it around. Let's do the same thing with the lead O'Brien Center researchers from around the country and the NIH program directors. So I organized everyone else on the patient advisory committee that we would send a letter to saying just how important you are to us and that you matter. And yeah, I didn't know what kind of response we would get. Well, every single program director who's associated with the O'Brien Centers sent us a personal thank you letter to say how meaningful it was. Yeah, then for the researchers in the room, yeah, just a huge shout out to you that I'm on the one drug that'll slow down PKD. It makes me drink 4 or 5 liters of water per day. I've got my water supply right here. Yeah, and yeah, it had something of a torturous path to approval. Yeah, it started out getting rejected by the FDA. It went back for more research. 5 years later, it finally got approved. I was at the airport when I got an email that it was approved. I said to myself, I am not getting on that plane. I'm not risking losing cell phone connection before I email one of the researchers that I know who brought to market to personally thank them. To this day, I have never missed a dose. People are like, oh, you'll give up on this because it means you're drinking so much, you're going to the bathroom all the time. And yeah, there's been times I'm not a perfect person by any means, that it's 10:30 at night, I realize, oh, I didn't take my afternoon dose. I say to myself, well, so many people worked so hard so that you could have this. It doesn't matter you're getting up 4 times tonight, you're taking that dose. Yeah, and yeah, and with that, I am a huge fan of kidney research. That I signed up for every single trial I can, and I fully encourage everyone here and online who has the opportunity to encourage people to sign for clinical trials to do it. I did a genetic trial. I always thought I was PKD1. If you saw my kidney decline function chart, it looks like classic PKD1. Turns out I'm PKD2 due to the trial I was in. I said, you're wrong, retest it. They retested me. No, they were totally right. And yeah, I know that, yeah, we're all busy as with the way medicine is, never more so. But I really urge you to think through and say, okay, what matters to you personally? What makes you unique? And how can you drive that forward? And I found that when I put my foot forward, nephrology just pulls me right in. a few months ago, I wrote C. Jason and said, hey, if I see you have a monthly column called The Patient Voice, if you need someone to write a guest piece, let me know. I didn't think I'd ever hear from them again. 2 weeks later, they said, here's your piece and here's your deadline. In fact, just the other day, I was telling Dr. Brown before we started, I got my issue in the mail and I said, oh, I wonder who wrote The Patient Voice this month. I opened it up. I'm like, oh, it's me. Yeah, and yeah, I just used the other journal as an example here, where they are literally looking for people to join their internship programs. And I've been on nonprofit boards for 20 years now. Every single one I've been on, you got committed leaders who love the organization to the core of their being, and they desperately, desperately want people that can take their place and take things to the next level. And they're always nervous about picking the wrong person. Yeah, so yeah, for the nonprofits around the kidney world, yeah, don't be shy about reaching out and saying, what you do really aligns with what I'm deeply interested in, and how can I participate? They may well, in my experience, what I find is they'll quickly put you on a troubled committee to see what you can do. And very quickly, you're rising through leadership. Yeah, or another example is Dr. Zakova mentioned the Neph Madness. Yeah, they reach out to me. Yeah, they knew that I love the tournaments. They reach out to me and they say, well, could you write a couple of patient voice articles for us? Which I'm happy to do, because I use that as a way to advance where I'd like to see nephrology going in the coming years. And yeah, I think we're at just an incredible time right now, that so much has happened between SGLT2s, GLP-1s, xenotransplantation experimentation, that yeah, now is the time for us to say, okay, it's been a great run, starting from the beginnings of dialysis to today, but yeah, we have this opportunity to make it an even exponentially greater run going forward, that the clinician of today who disappears for 10 years and comes back and pops into clinic should find that what they see in clinic is unrecognizable from what they saw 10 years ago. And we should be able to repeat that over and over again. And yeah, don't underestimate your influence. If you look at Cole for Scribner, the inventors of the dialysis machine and AVF access, they were going strong in their 80s. Yeah, we repeat that. If you're, let's say, 30 today and you're a fellow, that means your mentee could still be practicing for 150 years. So yeah, don't underestimate the reverberations of the influence you are going to have. That's Kolf and that's Scribner on the right. And yeah, and again, even in this time constrained era, really think through, yeah, not what everyone else thinks you should be doing, but nephrology is so vast. Yeah, what is it that drives you? Yeah, when you're leaving work and going home, yeah, what is it that you're saying, I wish, fill in the blank? Or when you get the journals in the mail and your eye scans through the table of contents, what's that topic you're looking for, you wish was in there? Yeah, and then put yourself in the overlap of that Venn diagram. That, yeah, if just each of us in this room were to do that, imagine what nephrology becomes over the next few years. Yeah, and then just to remind ourselves, you know, just as a thought experiment, I put together and say, okay, what are some of our greatest hits over the past few years? I don't expect everyone to agree with everything I put down. And if you had some seminal paper that's not on this list, yeah, no offense. Yeah, with the transplant trial that came out yesterday, I'm really happy to say that you could say, Arnold, your chart's already out of date, which I'm thrilled about. Yeah, but yeah, there's so much happening that our job is to say, well, what are we going to fill in these coming years in the light blue? And there's so much potential that, yeah, if we were to increase the effectiveness of the nephrologist tool set, yeah, a lousy 5% per year, that means the fellow of today is going to end their career with a tool set literally 7 times more effective than they have today. And with the motivating factors, when your patients look right through you, yeah, your personal effectiveness as a physician, let's put a number on. Let's say you'll be 10 times more effective, yeah, at the end of your career than you are today, just by making sure that this graph keeps going up and up. Yeah, and the thing I love about nephrology so much is it's so interdisciplinary that, yeah, with Zeno, who would have thought that the overlap of zoology and nephrology? Yeah, or a few years ago, I read a study about how the rock formation in mountains looks a whole lot like kidney stones. I mean, who would have guessed? Yeah, so no matter what your interest is in life, yeah, we know you're interested in nephrology. Put them together and see where that leads. Yeah, where that, yeah, 1 + 1 equals three or four. Um, and yeah, and let's not forget the human aspect of nephrology. That Dr. Zakova was kind enough to host me at Grand Rounds last year when Dr. Cervantes spoke. I'm sure some of you were here for that as well. And she talked about her advocacy that got dialysis coverage for the undocumented who previously in Colorado had to literally crash into the ER on the verge of death week after week after week. This is her patient, Hilda, who had to do that with a very unfortunate outcome. And yeah, it's people like that that totally motivate me, both the story of Hilda and seeing a Dr. Cervantes, where here she was practicing medicine. She saw something that really, really bothered her to the core of her being, and she reinvented herself as a policy expert, as a researcher, as an organizer, and it has done absolute wonders for her career. She's on NIH committees, editorial committees of the leading journals. I'm sure that was not her motivation. I'm not going to speak for her, but yeah, she is, for me, a role model of what happens when you take on the big challenges in nephrology. And I've studied a lot about social change and how to affect social change. Watching her Grand Rounds was like watching the master. I'm sure for many of you, you can see the Grand Rounds of a master clinician, a master researcher, and say, I am sitting at the feet of the master. That's how I felt watching Dr. Cervantes when it comes to organizing for social change. And that really motivated me for my next thing that I'm doing in the kidney world, where I thought about Dr. Cervantes. I thought about Esme Liz, who's the coordinator for the O'Brien Center, and she posted at Kidney Week last year how her cousin had died of a truly orphan kidney disease, so orphan that there was not a single presentation or poster in all of Kidney Week on the disease that her cousin had died from. And then knowing what so many researchers have been going through with the funding issues coming out of Washington, I said to myself, yeah, we cannot sit here and do nothing. So I went to some folks at the ASN, some people that organized some gatherings in years past, Dr. Katie Rizzolo, and said, yeah, with everything that's going on, we have to do something. And could we do like a meetup of people who are interested in like advocacy, population health and whatnot? Well, one thing leads to another, that with the help of Dr. Cruz, Dieter Cruz, and the ASN, they came together and they are literally giving us the best time slot in the best real estate at Kidney Week to do a meetup for people who are interested in these issues. So for those of you who've been to Kidney Week, there's that big main reception on Thursday night that everybody goes to before they leave for like their division parties and whatnot. Well, we've got the ASN Community Lounge during that event that everybody's invited to. If it's a topic you're interested, by all means, take a picture of the screen and feel free to invite anybody else. But I'm super excited that we're doing this, especially at this point in time. Yeah, it's building on some previous efforts that have been done in years past. So we're taking their lessons learned and applying it going forward. And yeah, what I really hope is that, yeah, we, in the coming years, Yeah, we are able, I have absolutely no doubt, and I have complete confidence in the people at Northwestern and so many other, all the other institutions I've worked with, that we can take today's nephrology that was once revolutionary, do another revolution. And so things like the I Hate Dialysis Facebook group goes from 34,000 members to zero. Yeah, and with that, yeah, I think we do all this, we end up creating a medical specialty on a hill. One that every other medical specialty, they will all be first among equals, but then there will be nephrology that sits at the top of the mountain, that people will look and say, what did nephrology do? How did they come together and create incredible change after incredible change, and that every other specialty will seek to emulate what nephrology has done. So with that, thank you for your time. I really appreciate you coming out to hear my talk, and I am totally open to any and all questions you'd like to ask.